But first, it took a bit of pushing for the truth to come out. But now we know 6.5 million Victorians have lost a week out of their lives, locked down for a record third time now, because of a COVID cluster confined to just 19 cases with only one person in hospital. So no school, hardly any work, no going anywhere, millions of people's plans shattered, thousands of businesses massively out of pocket because Daniel Andrews panicked that he'd be out of a job if his rickety contact tracing turned out to be as dodgy and as inept as his hotel quarantine. Now, naturally, in the Premier's typically arrogant and self-righteous style, there wasn't even a hint of an apology at today's media press conference. He kept up this pretence of congratulating Victorians for shutting down their lives, but really, this was all about him. His courage, he thinks, in taking the so-called tough decision to lock us all up, he says, that saved the state from COVID disaster. But of course, shutting down anything isn't hard. It's the easy decision for weak premiers, given the federal government is still paying for JobKeeper and JobSeeker. It's staying open and building a system that quarantines and tests and traces to world's best standards. That's hard. Again today, we saw a Premier with a messiah complex who leads a government that doesn't trust itself or its officials to get even the simple things right.
If you have a look at it, the only person who made that claim, using those words, was the head of the AMA in WA. Go and have a talk to them about it, about the language used. We will work as hard as we can, to make the system as safe as it can be.
Even today, after his third statewide lockdown, over 19 cases only, Daniel Andrews still insists his government operates some kind of gold standard.
We work as hard as we possibly can to make sure that this system is as safe as it can possibly be. And I'm confident that everyone is doing everything they can, particularly with that willingness to keep on changing, keep on adding, doing more, doing better. It is constant. It's not some set and forget thing. Because that wouldn't be the right thing to do.
Some gold standard. I mean, this is gold standard spinning from the Premier to say that even today, his system, he reckons, is the best in the country. Well, let me tell you, people are not buying these lies anymore. Despite millions spent on an inquiry last year, Victoria is operating a hotel quarantine system, even now, that's so hopeless that virus variants, it can, be there in New South Wales and New South Wales can take in its stride, can't be contained here in Melbourne. And the whole state is at constant risk of shuddering to standstills. In news that will fill Victorians tonight with dread, the Premier refused today to rule out further lockdowns.
Well, I can provide no guarantees because I'm not prepared to pretend with the Victorian community that this is over. And the nature of urgent decisions means that there can be some notice period, but we don't get the luxury of giving people a month's notice. I'm just not in the business of ignoring advice. I'm not in the business of shopping around for the advice that suits me. The only thing that suits all of us is to keep control of this.
For months, Victoria's testing system was so hopeless, as we know, results were taking more than a week to come through. Contact tracing was poor, so poor that the Premier sent officials up to Sydney to learn how they do it. Yet after that, and the months he's had to fix the mistakes, we've had people in this latest outbreak waiting days for anyone from a contact tracing team to call them. And as I revealed on Monday night, we even had the farce of contact tracers calling the man at the heart of this nebuliser issue, calling him to discuss this virus when in fact he'd already tested positive over a week earlier than that, and he was sitting at the time in intensive care. On Tuesday night, I showed you the total inadequacy of Victoria's QR code system when compared with New South Wales. The very fact that New South Wales has a system that puts all of your information into one centralised database is telling. It makes it so simple then when tracers need to contact you and join the dots about where you've been and who you've been with. That's happening now in New South Wales. Yet in Victoria, every pub and club and restaurant operates their own QR code system. They're not linked like they are in New South Wales. The tracers in Victoria start blind with every outbreak. And many places, and I've seen this myself, in Victoria are still operating with pen and paper lists, even now. I've got to say honestly, Victoria, we never stood a chance. I mean, we were locked down last year for 4 months plus, and we all thought then, didn't we, when we were locked down, that the government was working day and night to get all of this fixed so that when we opened back up again, the system could be the best it could be. I mean, God only knows what they were doing last year, but it wasn't fixing any of these mistakes. And what angers me most here, I have to say, is this paralysis in proper government decision-making. There's no weighing of COVID health risks against other health risks, like people delaying cancer screening or heart tests, or weighing it against the health risks of the economy, business closures, job losses, schools closed, or suicides. All anyone in the entire Victorian government thinks about is this one bloody virus. Nothing else matters because the Premier has decided this is the one thing that might actually cost him his job after surviving all his other crises. And cost him his job it should. If not for the 800 deaths last year, but his complete failure to learn from those mistakes. This bloke is a fraud. He thinks that by talking, he's leading. Indeed, Daniel Andrews has mastered the art of talking for hours without ever telling us the truth. Of taking question after question, as he does in his press conferences, but never actually answering them. Spin, arrogance, the fear that he wields behind this benign front, it's breathtaking. As always, today he insisted that the lockdown had nothing to do with him being a control freak. It was all based on health advice. Even though there are any number of health experts, more qualified, I might add, than Professor Sutton, epidemiologists, who think that lockdowns must be only used as a last resort, not the first resort. And a lot of these experts now, I just can't fathom why he locked down the state over just 19 positive cases. Today, Andrews was pushed on this and he insisted that he had released all the health advice. But he's never released health advice. Today, he had to admit that actually all he has released are the health orders. The bit of paper that's signed at the end of the process. None of the official advices that go into the decision to shut down the state.
Will you release that health advice? And don't
well, this is a bit of a word game. To be honest, this is a bit of a word game. The Chief Health Officer, I'll get advice, and I've not yet got that advice because, frankly, it wasn't the number one concern about the Cabinet document. But the Chief Health Officer, and he could do it again if you'd like him to, I'm sure, the orders, which are publicly available, are his advice. And his signature's on the bottom of them, and that's what was presented to Cabinet, and that's what was agreed. So the advice has essentially been released because it is the orders at law, the rules, that the Chief Health Officer signed off on.
He is as slippery as an eel. He's also trying to maintain the fiction that the so-called UK strain is wildly infectious, even though people with this variant will pass the virus on to just 15% of their close contacts versus 11% from the original Wuhan strain. A little more infectious, sure, but not needing a third statewide lockdown. For political gain, the Premier has played the fear-mongering card with this virus, even though not a single person seems to have been infected beyond the people who lived with or dined with those who caught it in his badly run quarantine hotels. He still won't apologise for scapegoating patient X, the man with the nebuliser. We'll hear from him shortly. And having told us every day since last Friday that he'd have more to say, he said, on compensation for all the people and businesses who've lost money, he sits there drawing a full salary, yet nothing yet on compensation. nothing. He can lock down a state in a heartbeat, can't he? But a compensation package, well, says this clown today, that he can't rush. Honestly, this government should be gone. It should have resigned in shame, and Victoria's governor should be sending us all to the polls. But because of a weak public service, a still largely fawning media in Victoria, a muzzled opposition and an intimidated Labor caucus who can pick up the phone to me, but they can't roll this bloke that they need to, Andrews is still in charge. From the Prime Minister down, people seem overawed by this bloke's bullying arrogance. As for the Victorian public, well, I reckon they're no longer fooled, no matter how often Daniel Andrews tells us how good he is. Well, Fig Jam Dan, you are a joke.